My name is Simran Noor. I am Vice President of Policy and Programs at the Center for Social Inclusion. And I have the privilege today to talk with you all about removing barriers to breastfeeding. Just want to talk for a second about the Center for Social Inclusion. We are a national nonprofit. We're based in New York City. And our focus is really to catalyze local communities, government, and other public and private institutions toward the end of dismantling structural racial inequity. And we do that through the strategies named on this slide that I won't go through, but just to name that our focus at CSI, the privilege of the work that I get to work on, is really about centering race and bringing race into the conversation, because we know whether or not we acknowledge it, race is a key driver to the inequities that we see. So what is race? It's important that we establish what race is before we talk about it, right? There's a great film called Race, the Power of an Illusion. This is the graphic of that film. And I would encourage everyone that, that if anything I say today doesn't make sense or you want to learn more about it, it's a PBS film. There's a 3-part series, all an hour long, and incredibly powerful in unpacking the history and foundation behind what race is. And I would just offer 3 kind of key assumptions as we enter this conversation about race. The first is that race is a social construction, right? There's no biological differences between different races. And if there's any questions about that, please watch the film. The second is that policy has driven the ways in which we think about race. So who was considered white in different points in our history has changed and shifted. And policy has certainly held the power and influence of determining what that meant and what the implications of that has been. And the final point that I like to make in framing up this conversation is that none of us in this room created this system, right? None of us actively created it, and yet we all have a responsibility to address it. So why do we focus on race? Why is race so important to us at CSI? So what we know, this graphic is from the city of Seattle, where some of our work has grown out of. And what they found in King County and in Seattle is that across every indicator of health and well-being, whether we're talking about education, jobs, equitable development, arts and culture, that there was a racial disparity, that inequity existed. And that matters, right? And it's not natural that we created these disparities, and our policy and practice sustains them. So just a quick exercise to get folks moving. I know you just had a break too, but some of the inequities that are so powerful to consider and think about in the context of birth and breastfeeding, and also kind of in the bigger picture that many of the early morning speakers talked about today through their stories. The first one that I just want to highlight 3. So the first is that an average white family in this country today has 16 times more wealth than the average black household. So if you look to your right and your left, if you're sitting at a table, if you could imagine that a white family has about $15.63 of wealth for every $1 that owned by a typical black family. And that statistic also rings true in that for every $1 owned by a Latino family in this country, white families own $13.33. So if you look to your right and your left, to the people around you, and imagine yourself having $1 and those folks having much more than you in terms of wealth, which is what you own minus what you owe. Second statistic I just want to share, and if everyone could stand up quickly in the room. There's about 200 of you. And imagine that we, as a room, constitute the United States. So if the right side of the room could sit down, 56% of residents that live near hazardous waste facilities are people of color. So if you can imagine that more than half of this room were people of color that live near hazardous waste facilities, right? Huge amount of folks that are affected by the inequities that we see. You all can sit down, thank you. And the final statistic that I want to share, and Kimberly referenced this in her talk as well, white Americans are 5 times more likely to live in a census tract with a supermarket. And you know, of this room of 200 people, that means that only 4 tables, if we can imagine, maybe that corner of the room, for black families have access to healthy food. And you know, folks, you know, we hear a lot that, you know, it's not about race, it's about income, it's about education. And I would just, you know, hopefully you'll come to my presentation after this if you're interested, because we'll unpack this a lot more. But just wanted to offer one statistic about, to name that something else is operating, right, in our system. So babies born to black women with a college degree are more likely to die in the first year of life than babies born to white women who do not finish high school, right? Something else is operating in this conversation. And you know, why do we talk about equity and not equality? Just wanting to define some terms before we get into it. Equity for us at CSI, and the meaning of the word equity, means trying to understand and give people what they need, right? So equality holds that everyone should get the sameness. What we know from this work, I'm going to define racial equity in a second, is that we're not all starting at the same place. We just talked about some of the disparities that are plaguing communities of color in this country. We're not starting at the same place, and therefore giving us the same things isn't going to close the gaps that are persistent, pervasive, and in fact killing communities of color, mothers of color, babies of color, right? So when we're talking about racial equity, we're saying that race is no longer a determinant of the life outcomes that we see. And actually, in addressing racial inequity, we improve outcomes for everyone, including white folks, right? And how do we do this? We have to target strategies. We can't have a universal strategy to close gaps along racial lines. That doesn't even make sense, right? Feel free to clap, it's fine. And we have to move beyond services and focus on changing policies, institutions, and structures. That's where we at CSI enter the conversation. And the last thing I'd say about racial equity for us, and I hope for this room, is that racial equity is both a process and an outcome. So how we get to these results that we want, how we get every mom to breastfeed, regardless of race, and breaking down those barriers, that has to be as much about the approach that we employ in developing policy, in thinking about the folks that need to be involved in that, as much as the outcomes that we're driving towards, right? So what is this thing, structural racial inequity? What is that? Such a wonky term. So just wanted to say that structures are part of our lives, right? So they are where we work, they're where we play, where our kids play, whether or not we have access to things like hospitals and healthy food, and our employer. And whether or not there is a coordinated, multimodal transportation system that connects us to what we need, the amenities that we need, right? And when we at the Center for Social Inclusion are talking about social inclusion, we're essentially talking about the communities that hold all of these things, and in particular for communities of color, because we know that that's not the case and tends not to be the case for those communities. So structural racial inequity points to the multiple institutions and structures that are at play, right? So in this graphic, you see a number of those. There could be many others, and any of them could be in the middle of the circle, but they're all interconnected. It is the ways in which our public and private institutions interact to create opportunity for some and barriers for others. The thing that I like to say on this slide is that, one, and I said this before, but just to say it again, racial disparities are not natural. They're not natural. We've created them. There's no natural selection of one race continuously and persistently being at the bottom. Intent to discriminate is not required. It's irrelevant. Perhaps, and we could argue that today, given our political discourse, but you know, perhaps at one time in this country, and actually not perhaps, absolutely at one time in this country, if you read policy history, intent to discriminate was required, right? Many of our policies were rooted in that. Today, what we say is that if we're not proactively thinking about and examining race, we're going to continue to get to those same outcomes, whether or not we intend to. So, you know, So to get to breastfeeding, to get to this group, to get to this room, you know, we all know these breastfeeding rates. You all are the experts in this. And the only thing that I would say here is, one, we don't have a robust set of data to really talk about Asian American mothers, which is unfortunate. And even within these groups, we don't have really a nuanced understanding of what the reality is in terms of numbers for breastfeeding rates. But I did want to say that Duke and Columbia University found that every additional year of parental residence in the United States for immigrants results in a 4% decrease in the rate of breastfeeding, right? So there's something in our country and in our systems that is creating barriers. So we at the Center for Social Inclusion had the privilege, thanks to the W.K. Kellogg Foundation, to develop this report called Removing Barriers to Breastfeeding. I hope all of you will visit our website and download the report. And in that report, we took a three-phased approach. First, we did some relationship building, set some context, because for us, race is our central frame. Racial equity is our vision. And then we look at various policies to see how we can get there, right? So we had to do some deep context setting and understanding of your field, of your body of practice and knowledge. We talked to about 20 field leaders, many folks in this room, thank you, to really inform our research and have a deeper understanding of it beyond just the data. And we surfaced some policy entry points that I want to talk to you all about in just a second. So why is breastfeeding structural? Why is it about structural inequity, right? For us at CSI, we really saw it as three institutions, three sets of policies coming together. So absolutely community resources and community conditions. I talked about some of the disparities that we see within that realm of the world already. Medical infrastructure is another key intervention point that many of you work on in this room, right? So for us, really looking at physician training, knowing that Baby Friendly USA is earnestly working to change this, but less than 5% of baby-friendly hospitals are in the 9 states plus DC with the highest concentration of Black Americans. We know in terms of employment policies, the Affordable Care Act, while had some great breastfeeding provisions, huge questions about not including Medicaid and WIC coverage, for example, and what break time for nurses would really look like. So what were some of the so what we know at CSI is that, you know, often when we're thinking about this conversation about race, we think about how do we change hearts and minds? Like, how does that happen? How can we just get everyone to think differently? And that's incredibly important, and there's a body of work at the Kellogg Foundation that really thinks about and works on that. What we found at CSI is that if we can incentivize and change behavior, it can go a long way in changing minds. So if we've always done things in the same way, it's very easy to think in the same way. But if we can, through institutions and through policy, begin to disrupt those patterns of behavior and incentivize a new way of doing things, we can actually begin to shift those hearts and minds that we so desperately need to. So what are some of the things that we can do? You know, I talked a lot about what the problem is, and now I have 1 minute and 30 seconds to talk about some of the solutions. So one of the things that we advocate for in that way to incentivize a different set of behaviors is to really use racial equity tools or a series of questions that can help us surface who's benefiting from this policy or practice decision and who's really burdened by it. If we don't have a sense of that, we are blindly continuing to advance and complicitly perhaps advance the disparities that we see today, right? As a partner, thinking about racial equity as a process, what does that mean? So if you don't partner with communities, and I think many folks have said this even in the realm of just thinking about how breastfeeding support is, you know, how we do breastfeeding support, but start where folks are. Talk to them where they are. Build trust. That takes time. That takes a resource commitment. That takes space. Prioritize what people are worried about. What's on people's hearts and minds, and think about how your issues connect to those, and really think about what's the existing infrastructure in communities that you can build upon. As a policy advocate, really thinking about what are the policy entry points that are structural, and this kind of describes what a structural intervention could look like. But in breastfeeding, you know, some of the things we highlight in the report is For example, in King County, in the Seattle region, breastfeeding is now a public right. Also, Dr. Maybank mentioned in New York State, right? Incredibly important in shifting how a community thinks about breastfeeding. And the Brooklyn Empowerment Zone that you all got the privilege to hear about this morning, thinking about how support can be held through multiple community institutions. And then, we can't ignore the prevalence and power of formula companies. And if the US could adopt the International Code of Breastfeeding Substitutes and really have some regulation around how a mother is marketed formula, we could go a long way. In the medical industry, we know that increasing baby-friendly is important. What I would encourage as we spread this model of baby-friendly is really thinking about scale. What's the scale that communities of color need to engage in those set of practices? What are the resources that's going to require for hospitals serving people of color? And how can those practices, and I know many folks in this room are thinking about that, but better serve Native communities and our Latino and African American mothers? Also we need to think about how we diversify the field of lactation support and ensure that regardless of certification or professionalization, if you will, that folks can survive and have an economic viability through that support that is often vital for a baby and their mother. And then really looking at the Affordable Care Act. How do we really get implementation to a different level, standardization of WIC policies, and clarification around what ACA can and should cover. And then finally, just thinking quickly about employment. We all know this, but we desperately need paid maternity care in this country. And not just for some mothers, for all mothers, for mothers that work an hourly wage, for mothers that work a salaried wage, and for fathers as well, right? And also we could think about how childcare supports, for example, could integrate a smooth transition to support breastfeeding for moms as they re-enter the workforce. So the final thing that I wanted to share, I have the privilege of convening, again, through the support of the W.K. Kellogg Foundation, this group of amazing women, many of them peers and colleagues in your room, to be your field builders. So we are working for the next 18 months, co-learning and creating a learning community around racial equity, structural racism, and breastfeeding. And they will hold a deep capacity, knowledge, and partnership with all of you and with the field to advance this conversation within the field. So if folks from our cohort are in the room, if you could just stand so we can celebrate you. So in closing, I know I talked a lot about the big challenges ahead of us, but just looking around this room, I know that we have the power, the knowledge, and the expertise to get to a different set of outcomes for every mother and every baby. Thank you.